Dermatology and skin oncology applications. Different pathologies have specific ultrasound patterns that help to differentiate various skin diseases. So the high-frequency ultrasound is useful for non-invasive skin pathology differentiation that is essential for proper clinical diagnosis, for objective disease severity assessment and adequate treatment choice, and for treatment effects, quantitative monitoring and dynamics. The ultrasound scanning is actively used by dermatologists all over the world, allowing to expand the diagnostic capabilities of visualization not only on the skin surface as in dermoscopy, but also throughout the depth. Determination of tumor's depth, internal borders, and blood flow. High-frequency ultrasound is the only available method for in vivo determination of tumor size, invasion depth, margins character, and tissues involved in the neoplasm process. This clinical information is vital for preoperative planning, full tumor excision with clear borders, and avoiding relapses after the excision. Melanoma Breslow and Clark indexes high-frequency ultrasound determination. It determines the need for additional diagnostic procedures such as remote metastasis search, regional lymph node biopsy, which is very important for patients' 10-year survival rate. It allows to choose an adequate surgery volume and plan the adjuvant therapy such as a chemotherapy, immunotherapy, or radiotherapy. Basal cell carcinoma clinical force differentiation. The very specific forms like superficial, nodular, scleroderma-like, and micronodular should be treated in different ways. At present time, high-frequency ultrasound patterns for the different BCCs are well described in multiple studies, and clinicians are using this diagnostic information for the proper treatment method choice. High-frequency ultrasound malignancy criteria. High-frequency ultrasound scanning provides a simple malignancy criteria for skin tumor diagnosis. The most informative malignant signs are the tendency of constant growth, uneven irregular margins, vertical growth orientation of the tumor, and increased vascularization during the Doppler imaging. If one or more malignant signs are found, the tumor can be preliminarily classified as malignant. Summary oncology application fields. Quick and accurate quantitative examination of the tumor structure, tumor invasion depth, epidermis, papillary dermis, reticular dermis, subcutaneous fat, tumor margins, and its characteristics, determining the blood supply of tumors located in the skin, choosing the optimal site for targeted biopsy, measuring of the tumor size and the surrounding tissue volume to be removed, metastasis identification in the skin and subcutaneous tissue. For patients with suspected melanoma, non-invasive defining of the Breslow index, Clark stage, and TNM classification in vivo, and for postoperative monitoring for the early relapse detection. So, dear colleagues, as we could see today, high-frequency ultrasound is a comprehensive system for complete skin examination. The universality of the system is that it allows to visualize the skin from above using dermoscopy and examine all the changes inside the thickness in all layers. When examining the skin in all layers, there is such a high resolution of up to 24 microns that minimal changes in individual layers can be assessed. The system has special software designed specifically for the skin. Thus, a very detailed examination of minimal changes inside the skin, even in the epidermis, is carried out separately in the papillary and reticular dermis and the hypodermis.